How do male and female sterilization methods differ? Imagine choosing a permanent way to prevent pregnancy that fits your lifestyle. Male and female sterilization methods are both options, but they differ quite a bit in how they are performed, their risks, and their recovery times. Let's explore these differences so you can make an informed decision. Male sterilization, called a vasectomy, is a quick outpatient procedure usually done under local anesthesia. The doctor makes a tiny puncture or small incision to access the vas deferens, the tubes that carry sperm from the testicles. These tubes are then cut, sealed, or blocked to prevent sperm from mixing with semen. The no-scalpel technique is common and involves a small puncture, which means less pain and faster healing. The whole process takes about 20 minutes. Most men can return to normal activities within a day or two, and the procedure is highly effective with a failure rate of around 0.15%. Risks are minimal, and it does not affect hormone levels, sexual desire, or ejaculation. Female sterilization, often called tubal ligation, is more invasive. It involves blocking, cutting, or removing sections of the fallopian tubes to stop eggs from reaching the uterus. This procedure usually requires general anesthesia and is performed through laparoscopy or a small abdominal incision. Because it is more invasive, recovery takes longer, often several days, and may involve a hospital stay or extended outpatient care. The success rate is slightly lower than vasectomy, with about a 0.5% chance of failure. Risks include surgical complications, anesthesia risks, and some women report long-term discomfort or pain. There is also a small chance of ectopic pregnancy if the sterilization fails. Cost is another difference. Vasectomy tends to be less expensive and more accessible, often costing a fraction of what female sterilization does. This is because it is simpler and requires fewer resources. Both procedures are considered permanent, though reversals are possible but complicated, costly, and not always successful. Vasectomy reversals tend to have higher success rates than tubal ligation reversals. It's important to note that neither sterilization method protects against sexually transmitted infections. Using barrier methods like condoms remains essential for STI prevention. Also, both procedures do not impact sexual desire or performance. Many people worry that sterilization might decrease libido, but scientific evidence shows it does not. Ultimately, choosing between male and female sterilization depends on personal health, preferences, and lifestyle. Men often find vasectomy to be a simpler, quicker, and less costly option with fewer risks. Women may opt for tubal ligation if they prefer a different approach, but they should be aware of the longer recovery and higher surgical risks. Always consult with a healthcare professional to discuss your individual situation, understand all options, and ensure the choice aligns with your reproductive health goals.